Good day, ladies and germs and gentlemen all over the world, from coast to coast, from morning to noon, from the ground to space. Welcome to Monday's version of Current Events. Yeah, my name is Diallo. This is our current events activity where we're going to go over what happened in the weekend that was. And today's date is December 14th, 2020. Wow. First of all, it's 2020, which is what? Amazing, right? Imagine there's still people alive right now that were born in before 1920, or they were born in 1920. That makes them 100 years old. They've seen a lot. Yeah, but they've seen a lot of change. Imagine like 10 years, 20 years ago when you had people born in the year 1895 and they died in 2000, right? They would have been, or they died in say 1995. So they lived 100 years old. And that 100 years from 1895 to 1995, what changed in that 100 years? Everything. Transportation, you went from no cars to cars. You went from, in a span of 20 years, you went from a plane that could barely get off the ground to a jet engine plane within 20 years, right? The automobile, you saw set land speed records in 50 years times. They broke the sound barrier in the 1950s, right? They went to space, they went to the moon in the 1960s. The moon. And literally 50 years before that, people thought it would be impossible. That's how much change. More has changed in the past 150 years than any 150 years in the history of humankind. It's insane, right? Like, let's say you had a time machine and you went back in time to the 1700s and you could take your phone with you, your iPhone with you, and you showed that to the people there, they would think you were a witch. They would think that your phone is magic. Well, how is it making light without fire, right? They would think that your phone was literally magic. That you're a witch, you're a sorcerer, and you might get burned at the stake. Unless you can convince the king that it's to his advantage. And because you came from the future, you know what's going to happen in all his wars. So you can dictate the outcomes of that, which, again, you get the butterfly effect, where if you step on a butterfly in the past, it affects all the butterflies in the future there on out. Crazy. All right. So let's get a look at our current events for Monday, December 14th, 2020. Again, we are reading from the East Bay Times, both the national, international, and local news sections for those. And what we always end with is good animal stories. Okay. So ask Amy section, and then we always end with news of the weird. So some kind of news from somewhere in the world that's very weird. All right. So as some of you may or may not know, that we're in a pandemic right now, it's COVID-19, and it's been hard on everybody during this time. But guess what happened over the weekend? They approved a vaccine that could be used. And this morning was the first time that vaccine was used on a patient. In New York, they did it this morning for the first time. And now you get the people, it's all healthcare workers that are first in line to get the injections, right? Because the healthcare workers are going to take care of all of us if we get sick, right? So they're going to get getting the vaccination first. But yeah, it's a great milestone because of Trump, and as much as people don't like him, you have to give him credit for his Operation Warp Speed. It's amazing that they were able to, in 9 months, start researching and complete the trials and the vaccines in 9 months. That's unheard of. And that could happen more if there was a financial incentive, but you know, it could take from 3 to 10 years to approve a medication. They did it in 9 months. That's insane. And the rollout of this, no matter who's president, is going to be exactly the same. There's no difference in the rollout. It's going to be messed up because the government can't do anything right. You tell them logistically to bring stuff to a certain place around the country. I have no faith in the government whatsoever in that. I don't care who's in office. No, logistics is not the government's best thing, unless that has to do with straight up money and screwing people. All right, so let's look at, for the East Bay Times, let's look at the front page here. What do we got? Share the Spirit 2020. Make a difference in your community. Yeah. So it is the holiday season now. So it's a time where lots of people love to be generous. Tip extra, tip waiters extra. For now, it's DoorDash. Definitely tip your DoorDash drivers extra. I mean, if you normally tip them like $2, tip them a $10 or $20. I wouldn't go over 20, but tip them 10 or 20 bucks on their order, right? That's going to make their day and have them more likely to stay out there and keep working because of your generosity to do that. All right, let's see what we got here. So this is the next first story comes from the Bay Area Toll Authority. So here in the Bay Area, when you cross the bridges, you got to do what? You get to pay a toll. And I remember when you guys are driving, there was a little thing where you stopped, and what'd you do? What'd you do when you drove to the bridge and you had to go through the toll? What'd you do? You would give the person the money, right? Well, now those people have gone away because not only because of the pandemic, but also because of Fast Track. So let's read about this. It says Larry Collins remembers getting the calls as he drove home one night in March at the end of a 10-hour shift collecting tolls at the Carquinez Bridge. So let's start that again. Larry Collins remembers getting the call as he drove home one night in March at the end of a 10-hour shift collecting tolls at the Carquinez Bridge. It was his supervisor telling him not to report to work the next day. With the state and country locking down to contain the coronavirus, officials were launching a temporary new toll system, which drivers who normally stop to pay with cash would get a bill in the mail instead. So when I go home, I go to Fairfield. So I have to drive over the Benicia Bridge. They still have the toll areas, but they don't have the people taking tolls. So you just drive through, right? And you get people who get mixed up. Instead of going through the Fast Track, they get over real quick, try to go through the tolls, and then realize that there's nobody in there. So it says, for decades, quickly handing over your toll of a few cents, then a few dollars, and then a few more dollars to a human being on the other side of an open booth window was a daily ritual for thousands of bridge crossing Bay Area commuters. The arrival of Fast Track 2 decades ago meant fewer and fewer people have been stopping to pay their tolls in person, though it was still a usual sight to see drivers lined up to pay cash and dwindling number of lanes where it was accepted. Now the Bay Area Toll Authority says collectors at the region's 7 state-owned bridges who were pulled out of their booths in the early days of the pandemic won't return even after the threat of COVID-19 recedes. Those spans joined the Golden Gate Bridge, which eliminated in-person toll collection back in 2013, and means that toll takers are a thing of the past throughout the Bay Area. So it seems like a lot of people are going to lose their jobs. Let's find out. We knew it was just a matter of time, Collins said. Fast Track, which debuted in the year 2000, was the writing on the wall, he said. The pandemic just sped things up. So let's go to page 6 now, and let's get the conclusion of this. This is interesting. Let's see, here we go. Let's see where we finished off at. It says, we knew it was just a matter of time, Collins said. Fast Track, which debuted in 2000, was the writing on the wall, he said. The pandemic just sped things up. The Toll Authority, which oversees the Bay Bridge, Dumbarton Bridge, and other state-owned spans, last year adopted a plan to more gradually end in-person tolls over the next 5 years. Eventually, they plan to remove the booths where Collins and his colleagues worked, remaking the toll plaza into open road operations where traffic can flow far more smoothly because drivers zip through and pay while barely slowing down, much less stopping. So from a traffic standpoint, it makes a lot of sense to take the toll booths away and just have the electronic things overhead where the drivers go through and have a little tag and it beeps and it takes money off a car. It's just faster and it's easier. But again, with progress, there's a double-edged sword. There's a double-edged sword to every decision you make. No matter what decision you make, no matter how good it seems, there's always going to be a downside. Always. Okay? Let's see here. But when the coronavirus hit this spring, making toll takers face-to-face interactions with hundreds or even thousands of people per day seemed far too risky, the authority had to scramble to implement that new system practically overnight. BATA spokesman John Goodwin said, "Since March, drivers in the cash lanes have been told to continue past the booths without paying or even stopping. Instead, a camera snaps a photo of their license plate and a customer service center sends them a bill for each crossing. It has worked okay, but not great," Goodwin said. The system got a break at first, as the lockdowns meant less than half as many cars were crossing the bridges compared to the pre-pandemic traffic. But since then, many of those cars have returned. Weekday traffic across the 7 spans is just 20% below what it was last year at the same time. The Bay Bridge now typically sees more than 100,000 cars pass through its toll plaza each day, down just 15% compared to the volume before the pandemic. Wow, so we're almost back to normal when it comes to Bay Area traffic. While about 3/4 of drivers use Fast Track, which hasn't been affected by the switch, that still leaves tens of thousands of toll notices that must be processed each day, which is taking longer because of the volume, Godwin said, and customers who call with questions about their bills are facing longer waits. Man. So because of that, because there's no toll takers and it's all with Fast Track, if you don't have a Fast Track, they're just sending you a bill. But because so many people are doing it, it's taking longer to get your bill. Right? And how much paper do you think they're wasting? How many trees do you think for something that can be electronic, period? Like crazy. Let's see here. As traffic volume has increased, that has put greater strain on the customer service center, Goodwin said. We are showing the wear and tear there. It's also costing the toll authority money. In October, Bay Area Transit Authority report found 9% of bills from bridge crossings between March and August had not been paid despite drivers getting toll notices by mail, amounting to $26.5 million in outstanding revenue. So just from August of this year, from March to August of this year, they have basically $27 million of outstanding toll booth fees. I'm probably one of those people. No, I'm not. No, I have Fast Track. So it just takes that on my account every day. And I only come over the bridge like 4 times a week anyways. I try to limit my time over the bridge because a week, it costs, if I go over 7 days a week, it's $42 a week. If I go over 7 times. So you figure that's a month. So you times that by 4.5. So it's about almost $250 a month across the bridge.
Wow.
Yeah. It's a lot of money. Yeah. Let's see here. I know. A new and permanent all-electric system will go into place sometime next year rather than mailing out a notice for each unpaid crossing. It will send drivers a monthly statement for all their tolls, reducing the amount of paperwork. Brilliant idea. Meanwhile, drivers can use any lane whether or not they have Fast Track, Godwin said, but it will take at least until the spring for signs and lane markings to reflect that change. The empty toll booths will be sticking around for a while, though. The plan to renovate the toll plazas is expected to take several more years for design and construction, but you can get glimpses of what's to come when you cross the Benicia Martinez Bridge going north. The fast track lanes there have been remade in the style of open road tolling with no booths or other physical barriers between them. That's the bridge I cross every day. So there's a whole left side of the bridge when you cross that there's no toll booths at all. It's just open lanes, and above each lane is a camera system that takes a picture and scans your license plate. So if you have fast track, it just takes the money off your fast track. And if you don't have fast track, it takes a picture of your plate, gets the information from the DMV, sends you a bill. So for a long time, there were people who they get a new car and they wouldn't put their plates on for a long time because they were never charged going over the bridge. Wow. Either going to San Francisco or the Bay Bridge or the Benicia Bridge, whatever. So they're never charged because they still have the dealership plates on it. And then after that, that's when the state really started cracking down. And when you buy a new car, the dealer's plates are actually your license plate, just it's a paper cardboard license plate that you have, that the dealership gives you. So if you go over the bridge, they're gonna take a picture and it has your license plate number right there. But you still got your motorcycle riders too. The motorcycle guys do is, as they're going up to the toll booth, they'll actually take out like something, a piece of cardboard, even their hand, and put it back behind so it covers up their license plate. So they don't get charged. And they go through, they don't get charged. Oh, man. All right. So let's go to our next. Let's look at what else is in the news here. Let's see. So here's a big one, okay? COVID-19 vaccine shipments begin in historic effort. So everybody knows, like I said before, there's COVID-19 going on right now. And the vaccine just got approved over the weekend, and the first person got the vaccine today in New York this morning. So now they're shipping out from, I think it's Kalamazoo, Michigan, and another place in Florida or something like that. They're shipping out from a couple locations in America where you have UPS and FedEx and the Postal Service who are helping out with that. So let's read about this. This again, it's COVID-19 vaccine shipments begin in historic effort. And this is from Portage, Michigan. The first of many freezer-packed COVID-19 vaccine vials made their way to distribution sites across the United States on Sunday as the nation's pandemic deaths approached a horrifying new milestone of 300,000 people dead. The rollout of the Pfizer vaccine, the first to be approved by the Food and Drug Administration, ushers in the biggest vaccination effort in U.S. history, one that health officials hope the American public will embrace, even as some have voiced initial skepticism or worry. Shots are expected to be given to healthcare workers and nursing home residents beginning today. Quick transport is key for the vaccine, especially since this one must be stored at an extremely low temperatures. About 94 degrees below zero it has to be stored at. Wow, how about that? You hear that, Numble? This vaccine has to be stored at negative 94 degrees below zero. So 94 degrees below zero it has to be stored at. That's crazy.
Deep freezer?
Well, a deep freezer doesn't even get that cold. It's got to be a special freezer.
That's right.
That's insane. So let's see here. Early Sunday, workers at Pfizer, dressed in fluorescent yellow clothing, hard hats and gloves, wasted no time as they packed vials into boxes. They scanned the packages and then placed them into freezer cases with dry ice. The vaccines were then taken from Pfizer's Portage, Michigan facility to the Gerald R. Ford International Airport in Grand Rapids, Michigan, where the first cargo plane took off amid what airport officials called a jubilant mood. And I know they literally have military guard over these vaccines because some idiot is probably plotted to try to hijack a truck, right? Some idiot's probably done that. So they make sure they have the military guard in these trucks because the amount of money in these vaccines is huge. They lose a shipment, they lose a lot of money. So I can picture this could be a pandemic movie. We have some clandestine organization who's been hell-bent on stealing the vaccines so that they can have control over it and charge people a boatload of money. I think that'd be an interesting movie. Wouldn't be the best movie. It's been done. I mean, different aspects of the movie, the same concept has been done. So let's keep reading about the shipment of the vaccine. All right. This is a historic day, said Richard W. Smith, who oversees operations in the Americas for FedEx Express, which is delivering 630 some packages of vaccine to distribution sites across the country. United Parcel Service, UPS, also is transporting a share of the vaccine. Helping with transport of the vaccine has special meaning to Bruce Smith, a FedEx package handler at the Grand Rapids Airport, whose older sister, Queen, died after she contracted the coronavirus in May. She was hospitalized in Georgia one day after he saw her on video chat, and they never spoke again. I think she would be ecstatic to know that something that has ravaged our family, that a family member is going to be part of such a big project, said Smith, 58, whose nephew, Queen's son, also got sick and is still undergoing therapy for stroke-like symptoms. It is very important. Tracked with GPS-enabled sensors, the initial shipments were expected to contain about 3 million doses, with many more to come. Federal officials said the first shipments of Pfizer's vaccines will be staggered, arriving in 145 distribution centers today, with another 425 sites getting shipments Tuesday, and the remaining 66 on Wednesday. Doses of the vaccines, co-developed by German partner BioNTech, are given out based on each state's adult population. Then the states decide where they go first. In California, where healthcare workers will be among the first to be vaccinated, state health officials are prioritizing hospitals that have adequate storage capacity, serve high-risk populations, and have the ability to vaccinate people quickly. Initial surveys have found that even some healthcare workers don't want to be first in line. Dr. Graham Snyder, who's led the vaccine task force at Pennsylvania healthcare giant UPMC, estimates that about half of its employees are willing to get the vaccine as soon as it's offered. But many health officials expect enthusiasm to grow. There's the thought that maybe they don't have to be afraid to come to work if they can be vaccinated and be immune, said Dr. Sandra Kimberly, medical director of hospital quality at the 40 hospital Ochsner Health System in Louisiana and Mississippi. Employees approved for the first round are getting texts and emails directing them to schedule their initial injection, she said. Enough vaccine is being saved so that each person who gets in the first dose of vaccine can get a second required dose shot a few weeks later. Senior U.S. government officials, including some White House officials who worked in close proximity to President Donald Trump and Vice President Mike Pence, are among those who will be offered coronavirus vaccines as soon as this week. 2 people familiar with the matter confirmed. So that's an interesting thing about how they're rolling out the vaccine, right? So there's a certain number that goes out to each state, each city, based on their higher risk adult population. But once it leaves the federal hands, it's in the state hands, and then the states can do whatever they want with it. But most states are going the way of giving it to healthcare workers first. So now let's go to some local news. Let's see here. Let's see here. So here's one. Legislators push to reopen schools. So as we know, we have the COVID-19 pandemic going on. And one of the things people are worried about is their kids, right? Nobody wants their kids to get sick and die. So they close down the schools in California and a lot of other states around the country because they're like, I don't want my kid to get sick and die. But when you look at the actual statistics, kids, the death rate for, I think the number of kids who have died from this virus, and don't quote me on this, but I've heard this, is less than 300 kids have, under the age of, I think it's 12, have died from this virus. So less than 300 kids under the age of either 16 or 12 have died of the virus. That's not very many people. It's sad, but it's not very many. When that same time frame for that same age group, there's more kids that die from the seasonal flu than from this. Okay, don't quote me on that. Look it up. I'm not gonna look it up. You can look it up yourself. I'm just throwing that out there. That for certain age groups, and I think it's 12 and under, the regular flu is actually more dangerous than the COVID is for that age group. For everybody else, COVID's way more dangerous than the flu. But they don't know why this particular age group, it's almost like they're immune to it. So they're not carriers of it and they don't spread it. So that's why in some states schools are open. In a lot of countries, you have France, you have the Netherlands, they've never closed down schools. They never closed them down. And what the science shows is that schools are not huge vectors of transmission. They're just not. Teachers aren't getting COVID from schools. They're getting it from outside of school and bringing it in. But it's very rare that a teacher gets it from being at school. So let's see what this says. So legislators push to reopen public schools. And again, that's just my opinion. You can look it up, do whatever you need to do with it. A group of 8 California lawmakers will advance a proposal in January that would require states' public schools to reopen and offer in-person instruction once they receive permission to do so from state and local public health authorities. So that's another reason why they want to reopen schools, because there's been many kids under the age of 12 who've committed suicide during this pandemic. Under the age of 16 too. Kids, 13, 12, 11, 12, 13 committing suicide because of the pandemic, and they're so lonely and they need that physical contact with other people and other kids, right? Children need that. They need the physical, they need being able to learn how to be a man or a woman or just a person. They need that interpersonal physical connection. And they're not getting that with just being able to learn at home on a computer. They're not getting that. So a lot of kids are depressed. It's hurting our kids right now, man. So again, the Democratic legislators, Co-Authority Assembly Bill 10, one of the first bills introduced this legislative session, say the proposal is essentially in response to the fact that many public schools across California that had the state's permission to physically reopen campuses this fall remained in remote learning. If passed by 2/3 of the legislature and signed by Governor Gavin Newsom, the proposal led by Assemblyman Phil Ting, Democrat of San Francisco, would require public schools to plan the transition toward in-person instruction within 2 weeks after their counties move out of the most severe purple tier in the state's color tiered system governing schools and business reopenings during the pandemic. The schools would have wiggle room as to when and how they actually reopen, but the plan would have to be in place within 2 weeks. Under AB 10, which would take effect March 1st, public schools also would have to create more detailed plans for engaging students who are not participating in remote classes. This school year, several California students have effectively been shut out of online classes because they lack stable internet access or functioning technology despite state and local efforts to close the decades-long digital divide in the state. So there's a lot of kids, especially in poor minority communities, where they can't do the online learning because they don't have internet at home, right? So I feel like since a year since this whole pandemic has started, we're literally going to have a lost generation. There's going to be about 10 years worth of age of kids that are going to be a lost generation because they literally lost an entire year of how to grow as people in crucial times of their life, whether that's kindergarten, first grade, second grade, crucial times of their life of how to deal with a bully, right? How to do things in certain situations, how to navigate, like just little things like that. Kids aren't going to get that. You go, oh, they'll get it after, but it's not the same as getting it when you're 5 as when you get an 8. You have a whole different perspective on it. Yeah. So local school boards and administrators would still have authority to decide logistics such as scheduling, how their schools would transition to in-person learning, and which student groups to prioritize, lawmakers said. Parents would still be allowed to keep their children in remote learning if they wanted, and the proposal exempts certificated staff who are medically fragile from returning to campus in person, according to the bill's text. Though the state is not tracking reopenings, the majority of California public schools have remained in remote learning since campuses initially closed last March. Several counties, such as Los Angeles, home to the nation's second largest school system and more than 1 million public school students, have remained in the purple tier and thus restricted from broad school reopenings. Rural schools and smaller districts were among the first in California to physically reopen this semester, some as early as August. In October, after many counties moved toward the red, orange, and yellow tiers that allow broad campus reopenings, more urban school systems began transitioning toward in-person learning, namely in Orange, San Diego, and Marin County. Several other public school and private school purple counties have reopened campuses for elementary school students through waivers, though that reopening channel has mostly favored private schools. So again, they opened it for elementary school age kids because the science shows that they're the least likely to not only contract it and spread it, but to die from it. By far the least likely. Their rate of survival is like 99.99999999998. Right? And again, look it up yourself, do your own research, but I'm just saying the research that I've done, that's what I've seen with that, with the science. Again, it's following the science. Let's see here. Most of the state's 25 largest districts, though, remain in remote learning. San Bernardino Unified, the state's 7th largest district, said recently that it planned to stay in remote learning for the entirety of the 2021 school year. So they're staying in remote learning all the way till summer. Well, at least they let everybody know that up front. A lot of these school districts, they say we're going to reopen, and then literally a day before they're going to reopen, like we can't reopen, we're going to close down. And they keep doing that over and over again. It's like either tell me we're going to reopen or tell me we're not going to reopen for a year, right? Just tell me, even if you just say you don't know, we're not going to reopen until next year. Okay. It's the BS and the monotony that people can't stand, and the gray area-ness that people can't stand. Just give it to me straight, Doc. Right? If I'm dying, just tell me straight up, Doc. They'll be like, well, you're not really dying, but you are. All right. Well, yes, am I? Yes or no? Right? You can't be kind of pregnant. You either are pregnant or you're not. Let's see. San Francisco and Bay Area counties such as Alameda have moved to the orange tier this fall before infections climbed again statewide, though public schools there remain physically closed. In the fall, when numbers were going down, and we were actually doing quite well, I was surprised that more school districts didn't open, especially for younger grades. Ting said in a phone interview. The bill's 8 co-authors, including Assemblyman Patrick O'Donnell, Democrat Long Beach, and Assemblywoman Lorena Gonzalez from San Diego, who chaired the Education and Appropriations Committee, AB 10, would be required to clear for a vote on the Assembly floor. We don't want to get to the point where schools have sat on their hands for 12 months, O'Donnell, who chairs the Assembly Education Committee, said in a phone interview. What we're trying to do is emphasize that schools need to be planning today for the reopenings, and it needs to be thought through. It needs to be safe for students and for teachers. Claudia Briggs, a spokesperson for the California Teachers Association, the state's largest teachers union, said in an email that the union was reviewing the bill. We have been working with the state from the beginning to ensure the safe return to school for millions of students and hundreds of thousands of staff, Briggs said in an email. We know this legislation is a starting point and look forward to the continued conversation, which must be done collaboratively with the proponents with the proponents, educators, and administrators. So yeah, that's, yeah. People have to, we have to all talk about everything and opening of schools, and we all have to lay out the science and lay out pros and cons of everything. We're having a hard time now with a lot of states and mayors and stuff. They're not having open conversations with the public about the pros and cons, what's known and not known. They just say, oh, let me wave my magic wand and everything's closed. Okay, why? I'm a restaurant in California. You say you have to do outdoor dining. Okay, I do my outdoor dining. I spend $55,000 on outdoor dining. I've got it set up. And then literally 2 days after I finish it, the state goes, you can't have outdoor dining anymore. It's not safe. And you're like, wait, what?
Wow.
Where does it say it's not safe? And they just say, well, we're following the science. And you bring up all the stats of the science that clearly says outdoor dining should be open, and they just go, well, we're sorry, you're closed. So now you just spent $55,000 out of money you don't have to try to keep your business afloat, and 2 days later they close it down. And then what? And then here's something even funnier. You come to your restaurant the next morning, and literally 15 feet away, starting 15 feet away from your outdoor dining, is a giant tent with tables and chairs set up next to each other. Why? Because a movie studio is shooting a movie there. And they're going to shoot the movie, and all their people that work on the movie are going to eat under these tents that are real close together. And you're like, wait a minute. You're closing me down, but you're having a movie studio being able to film there? Like, what? And they're going to eat right next to my restaurant, which I can't even serve them food? Like, what?
Wow.
That's what we're going through when it comes to businesses in California. It's a cluster. I hope that story was very vivid for you. I put myself, that's actually a true story. Not from me, but from a woman who has a restaurant in Los Angeles. It's a true story where a movie studio set up shop the day after she was closed, literally right next to her restaurant. And there's, a couple hundred people working on this movie, and they're all eating from a takeout taco truck, and they're all eating next to each other. Like literally, I'm sitting here, and the other person's sitting right there. And they're all eating next to each other. And she's like, are you kidding me? I closed down my business and spent $55,000, and then you tell me I'm closed again. And now she can't even open her business, period. She lost everything.
Wow.
Because it's shut down, she lost everything. And they're saying that more than 60% of restaurants during this pandemic are going to go out of business. They're going to close down. So you're talking about all small businesses, and I guarantee you they're mostly minority owned.
Yeah.
So whether it's Chinese, whether it's Vietnamese, whether it's Filipino, whether it's Black, whether it's Hispanic, I guarantee you a large majority of those are minority owned. And they're just being thrown under the bus by quote unquote following the science. BS. Mm-hmm. Gavin Newsom. Wow. That's all I'll say about Gavin Newsom. Gavin Newsom.
That's enough.
Yep. Yep. All right. Let's see what else we got here. What's this band thing? What is this band? So here we go. This is about the pandemic, and we were talking about the businesses and restaurants. We know what time it is. Hold on. We still good on time? All right, yeah. It says businesses sue to overturn COVID-19 outdoor dining ban. This is just what we're talking about, right?
Yeah,
Yeah, you can go use them. Yep. It says restaurateurs say that eating outside presents low risk of virus transmission, which again, 100% true. That's following the science. A group of businesses in Contra Costa County filed a lawsuit Friday against the county's health department to overturn its ban on outdoor dining. Providence Bar and Eatery in Oakley, Bar Cava Wine Whiskey and Eatery in Martinez, Retro Junkie Retro Junkie Arcade Bar in Walnut Creek, and Layla in the Bay and Hercules are the plaintiffs, and their attorney says that they expect more businesses to join. Although Contra Costa County isn't required by state to shut down outdoor dining until its hospitals have fewer than 15% of their ICU beds available, it joined other Bay Area counties in doing so last week in an effort to slow the exploding spread of the coronavirus. So what they said was, we're only going to close down outdoor dining if our ICU bed capacity gets to 15%. Well, it never got there, but they closed down anyways. That's why a lot of restaurateurs are pissed off, because they're like, you tell us one thing and then you magically change it, right? When you see fit, you magically change it, even though it doesn't have anything to do with facts. So let's see. As part of its argument, the lawsuit quotes a June order of Contra Costa Health Services order that says outdoor dining poses a relatively low risk of transmission. We use the government's own words and findings against them in our motion, Joseph Tully, one of the plaintiff's attorneys, said in a statement. The lawsuit suggests the ban on outdoor dining will bring further misery to an already beleaguered industry during an otherwise busy winter season for restaurants and bars. The lawsuit follows an earlier act of defiance last week against Contra Costa County health officials when dozens of restaurants in Danville declared that they will remain open outdoors despite the county's latest health order. In the wake of the similar court challenge in Southern California, a judge last week ruled that Los Angeles County acted arbitrarily in enacting its own outdoor dining ban. Because the Southern California region's ICU bed availability is now below 15%, however, the state restrictions prevent restaurants and bars from reopening outdoors there. And that's because it got above the 15%. Okay, you set a goal, you set a bar, we got past a bar, we do this. Not you set a bar, we're not quite there, but we're going to shut it down anyways. Can't do that. Let's see here. In the Bay Area, about 17% of cumulative ICU beds are currently open, but Contra Costa and several other counties in the region chose to ban outdoor dining now rather than wait another week or two for the inevitable filling of available beds. Tully said a judge could rule on the local business's lawsuit as early as today. All laws must have a rational basis to be valid, he said in a statement. There is no scientific evidence to support a link between the county's ban on outdoor dining and the spread of COVID-19, which is, again, fact. The science is unclear whether outdoor dining poses a greater risk of COVID-19 transmission, though health officials across the state warn that unmasked gatherings of any kind with people outside one's household unit are unsafe. In the news conference last week, California Health and Human Services Secretary Mark Galley said the state's inclusion of outdoor dining in the latest stay-at-home orders was not a comment on the relative safety of that kind of gathering, but an effort to keep people home. So they basically said, yeah, we're doing it because we want to keep people home. Like, no, you can't tell us one thing and then do another thing. The lawsuit cites Galley's words in declaring there's no nexus between outdoor dining and the purported grave consequences of COVID-19. It describes various measures the plaintiff restaurants have taken to ensure the safety of customers, including physical distancing, sanitizing, and temperature checks. There has not been a single COVID-19 case traceable to plaintiff's restaurants since the inception of the pandemic, to their knowledge, the lawsuit states. A county task force is assessing the fines charged to businesses that have violated the county's health orders. In the past month, several gyms in Contra Costa County have received fines for breaking the rules, and a district attorney office spokesperson said last week that the criminal charges may be considered. Wow, so you have a gym, which nobody ever talks about how important it is to be in shape and to get in shape. This virus attacks your lungs. People have better outcomes when they're in better shape. If you're the government, if you're the media, the news, that should be one of the things that you're talking about is, hey, this is a great time. Not only people, they're already inside, they might as well get in shape, right? so that if they do get COVID, they're more likely to beat it. And if these people are going to get, you have so many people who are on the cusp of diabetes and having it, but they're not on straight insulin shots or anything like that, where they can literally not have diabetes anymore if they work out. My stepdad's a prime example of this, right? He was headed towards diabetes where he had to put insulin in every day. He started working out. He lost about 60 pounds. Guess what? He doesn't need his diabetes medication anymore. Doesn't need it because he got himself healthy. He's staying healthy. He's been healthy for the past 3 years. Right? This is what the news should be telling us. Should be telling the public, hey, gyms are good. Gyms should be open. Outdoors, they should be open for people to get in shape, to get better. Which I really do think that the next stimulus bill, the government should give everybody a gym membership. Plain and simple. Everybody in the country gets a gym membership to a gym. And what that does is it's going to help the gyms prosper more, okay? Because they're going to stay in business and more people are going to come to the gym, right? But it's got to be able to go to a gym of your choice that's next to you. You can't be like a $10,000 a day gym, right?
Crazy.
I would say it's got to be under $200 or less a month for your gym membership. Those are the gyms you can go that should be done. That the government should that the government should put in stimulus money, right? That's just my personal opinion. All right, so let's move over to our final stage here. Our final stage of reading. We didn't get to our normal Ask Amy section. I'm sad about that. That's okay. But I'm gonna do one anyways. Advice column for Ask Amy. Man boy needs to grow up. Yeah. Man boy needs to grow up. I am a 35-year-old woman. I'm 8 years older than Steve, my boyfriend of 2.5 years. Steve and I seem like a great fit together, except he owes me quite a bit of money and seems hesitant to pay me back. I'm sorry, dump the guy. He owes you that much money, dump him. And he hasn't paid you back ever, dump him. But we decided to split our shared expenses like food, travel, and rent. And because I end up managing most of the details of our life, his bill is creeping higher and higher. When he has offered to keep track of expenses, he has fumbled the ball and lost track, so it's become my job again. I don't earn a lot of money, but I have a very good saving it, but I'm very good at saving it. I treated him to a meal out here and there, but I can't really afford to pay for both of us all the time. Often we are out and there will be an issue with his car or he doesn't have any cash, so it goes on to his bill. I've told him a few times I would like him to pay me back in a more timely manner. He will reimburse me part of what he owes me, but then months go by before he pays me again. I don't think I'm doing him a favor if I pay for his life. He works and does have enough money to pay his own expenses. His parents are wealthy and pay for his phone bill, car insurance, online accounts, and manage his bank account for him. I have been on my own since my early 20s. I love him and need to find an effective way to address the issue. What can I do? I don't want to be a nag. Signed, Sugar Mama. Woo! We're almost done, Neville. So let's see what he get. Oh, go for it, Neville. Let's see what he has to say. Dear Sugar Mama, if Steve wants to become a functioning adult, then you can try to inspire him to approach this important issue, not as a loan officer, but as a partner. At the very least, you two should commit to a weekly meeting to review your joint expenses and settle up. You must agree to the concept of paying yourselves first, by each contributing to an equal amount towards your joint expenses and then withdrawing down that amount. You should also look at lifestyle choices and changes you can make in order to afford your expenses. Simple, right? All right. Well, that was a good one. Well, we're going to do one more. We're going to do News of the Weird. So I'm always going to do News of the Weird because I like that. Let's see what our News of the Weird is today. I know. Actually, News of the Weird is not good because it has to do with technology right now. So Again, thank you again for joining me. My name is Diallo. This is Current Events Monday on this Monday, December 14th, 2020. I will see you next time. It's gonna be my catchphrase. I will see you next time.